I look forward to the Government's response to the recommendations.
Paul Foster-Bell.
It's a pleasure to take a call in this debate on the Health Select Committee's inquiry into improving child health outcomes and preventing child abuse, with a particular focus from preconception until the age of 3. In continuing with the bipartisan theme of this debate and the seasonal spirit of goodwill which seems to be emanating from the House at the moment, I want to acknowledge all members of the Health Select Committee, not only the national ones and the excellent chair of the Health Committee, Dr Paul Hutchison, but also the opposition and crossbench members who served on the committee. In particular, can I pay tribute to the former committee member, Dr Jackie Blue, who I also succeeded as a list MP and whose place on the committee I took up in May. I know she had made a significant contribution to this report before I arrived, and I would like to thank her for her service. This is a substantive and highly substantial inquiry with a hefty series of hard-hitting recommendations. The committee believes, if implemented, it will have real impact on improving health outcomes and lowering abuse rates, which remain tragically far too high in this country. Given the time constraints of this debate, I want to single out one or two areas in which I believe there is particular importance. We report, sir, in the inquiry that immunisation is the most effective evidence-based way to prevent the spread of infectious diseases that previously caused severe morbidity and mortality rates. The committee had already undertaken considerable work in this area. A report was published on how to improve completion rates of childhood immunisation in 2011. So it has been very satisfying to see that immunisation completion rates for New Zealand children increased from a totally unacceptable 67% of 2-year-olds in 2007 to over 93% in 2013. The Minister of Health, the Honourable Tony Ryall, is to be congratulated for setting these high targets, and his unequivocal and unrelenting support for DHBs to deliver this essential prophylactic against serious, life-threatening, misery-creating and often very expensive communicable diseases. 12 district health boards have reported that their Māori completion rates are now even higher than those for non-Māori. Now, this is an historic achievement and one that other countries with disadvantaged Indigenous communities could do well to emulate. The hard-working teams of professionals, often using innovative methods to access hard-to-reach children, deserve our gratitude for delivering on this essential target. Now, while the target of 90% of 8-month-olds completing their primary course of immunisation by 2014 is already met, and a higher target of 95% of 8-month-olds by 2017 has been set, there are still many children who are not immunised, and to achieve this higher target, New Zealand will need to make a strong commitment to children's immunisation. We have done well, but we cannot relax and we cannot sit on our laurels yet. So this inquiry makes a number of recommendations for further actions in this area. We recommend, sir, to the Government that it requires the enrolment of children in general practitioner health services before discharge from the postnatal ward to ensure that they continue to engage with primary care and also well child services. We have suggested the continued implementation of the Ministry of Health's action plan to enrol, engage, promote and monitor to achieve these higher immunisation targets. We recommend further improvements to local monitoring and engagement among health professionals, and we support more choice for young people by allowing youth health services to advise on and manage vaccinations, especially for rubella and HPV, or human papilloma virus. And we also back the implementation of advice of the Immunisation Advisory Centre regarding hard-to-reach children and populations. We believe that these, combined with some of the other recommendations in the field of immunisation, will underpin a truly first-class set of outcomes in this area and enable New Zealand to become a world leader in preventing the spread of infectious diseases so that we can ensure that the lives of the youngest members of our society are not blighted by such diseases. Sir, I'd like to add to the thanks of other members for the officials and the advisors, particular thanks to our committee staff, Arwell, Charlotte and Tina, who assisted with the drafting of this report. Sir, I believe that this report's recommendations from maternal and infant nutrition through to early childhood education, from oral health to alcohol and tobacco, are very worthwhile. I commend it to all members and wish you, sir, a very Merry Christmas.
Call in Ms Galloway.
Thank you very much, Mr Speaker. The opening